What's behind the rise in heart attacks among young people? The total number of heart attacks in the United States is lower than ever before. That's great news, right? But don't celebrate yet because there's one worrisome problem. Heart attacks are increasing in young adults under the age of 40, including those in their 20s and 30s. Knowing what's behind the rise in heart attacks in young adults can help you take steps to protect your health and prevent cardiovascular disease. The research reveals that by understanding your risks and creating a well-thought-out plan, you can improve your chances and steer clear of a heart attack. Heart attacks are on the rise in patients aged 20-30 years old. Not long ago, heart attacks were primarily a problem faced by older adults. It was rare for anyone younger than 40 to have a heart attack. Now 1 in 5 heart attack patients are younger than 40 years of age. Here's another troubling fact to highlight the problem. Having a heart attack in your 20s or early 30s is more common. Between the years 2000 and 2016, the heart attack rate increased by 2% every year in this young age group. Your outlook isn't better following a heart attack just because you're younger. Patients who have a heart attack in their 20s or 30s face the same risks as older patients. Once you have that first heart attack, you have the same chance of dying from a second major heart event or a stroke regardless of your age. Diabetes is a key risk factor for an early heart attack. If you have diabetes, you're 2-4 times more likely to die from heart disease compared with adults who don't have diabetes. The problem develops when your blood sugar isn't controlled well enough to keep it within a healthy range. High blood sugar damages your blood vessels, which increases the chance of fats building up in your arteries and causing atherosclerosis. Patients with diabetes are also more likely to have other chronic health diseases that significantly increase the risk of a heart attack, including high blood pressure and high cholesterol. Young adults are now increasingly diagnosed with hypertension. Hypertension, or high blood pressure, is one of the biggest risk factors for cardiovascular disease. Unfortunately, just like the rising in heart attacks cases, the incidence of hypertension is rising faster in young adults than in older adults. The incidence of hypertension is rising faster in young adults than in older adults. High blood pressure makes your heart muscles thicken, harms your blood vessels, and increases your risk of a heart attack. Overweight and obesity are key players in heart attacks. Being overweight has a significant influence on your risk of having a heart attack for several reasons. For starters, carrying extra weight places a high demand on your heart. Obesity alone makes you more likely to have a heart attack even if you're otherwise healthy. However, patients who are overweight and obese often have other health conditions that detract from their heart health, such as high blood pressure, diabetes, and high cholesterol. Smoking cigarettes and vaping are major risk factors for a heart attack. Of all the things that contribute to heart attacks in young adults, smoking cigarettes is one of the top risk factors. Your risk of a heart attack increases in direct proportion to the number of cigarettes you smoke. Smoking 1 pack a day more than doubles your risk for a heart attack compared with non-smokers. While cigarette smoking has a much higher chance of causing a heart attack compared with vaping, you're still not off the hook if you vape. E-cigarettes contain nicotine and other toxic compounds that accelerate your heart rate and raise your blood pressure. A recent study found that vaping made you 34% more likely to have a heart attack compared with non-vapers. In the same way, substance abuse can harm your heart. Cocaine's impact on your heart, however, is well established. Cocaine increases your heart rate, tightens your blood vessels, and raises your blood pressure, all of which are associated with heart attacks. Many heart attacks are preventable because you can change your risk factors by making lifestyle changes and taking medications if needed to protect your health. Another concerning aspect of increasing heart problems is that you might experience a heart attack without even realizing it. A silent heart attack, known as a silent myocardial infarction, SMI, makes up 45% of all heart attacks and tends to affect men more than women. They are described as silent because when they occur, their symptoms lack the intensity of a classic heart attack, such as extreme chest pain and pressure, stabbing pain in the arm, neck, or jaw, sudden shortness of breath, sweating, and dizziness. Its symptoms can feel so mild, and be so brief, they often get confused for regular discomfort, or another less serious problem, and thus men ignore them. For instance, Men may feel fatigue or physical discomfort and poor sleep, or some general age-related ache or pain. Other typical symptoms like mild pain in the throat or chest can be confused with gastric reflux, indigestion, and heartburn. Also, the location of pain is sometimes misunderstood. With SMI, you may feel discomfort in the center of the chest and not a sharp pain on the left side of the chest, which many people associate with a heart attack. People can even feel completely normal during an SMI and afterward, too, which further adds to the chance of missing the warning signs. The number of people who suffer an SMI and don't realize it is alarming. A study from American Medical Association looked at almost 2,000 people ages 45 to 84, half of whom were men, who were free of cardiovascular disease. After 10 years, 8% had myocardial scars, which are evidence of a heart attack. Most surprising was that 80% of these people were unaware of their condition. Overall, the prevalence of myocardial scars was 5 times higher in men than in women. SMI and regular heart attacks share the same risk factors: smoking, being overweight, lack of exercise, high blood pressure, high cholesterol levels, and diabetes. They can be equally harmful. Even silent heart attack often leads to heart damage and scarring. What makes it even more concerning is that many people with SMI don't seek help. In fact, people who have an SMI and don't receive treatment have a 3 times greater risk of dying from sudden coronary artery disease. A silent heart attack is a loud signal your body sends that you have some kind of underlying health issue that needs attention. How to get checked out? Men may not be aware they had an SMI until weeks or even months later when they see their doctor for a regular visit, or because of persistent symptoms like fatigue, shortness of breath, or heartburn. SMI is usually detected from an electrocardiogram, EKG, or echocardiogram, which can highlight heart muscle damage. Another method is a blood test for the molecular footprints of troponin T, a protein released by injured heart cells. That test is often used in emergency departments for patients with heart attack symptoms. Once an SMI is diagnosed, your doctor can identify your main risk factors and help design a treatment strategy, including changing your diet, exercising regularly, and taking a statin as well as other medication to help prevent a second heart attack. If you ever experience any signs of a SMI, please don't ignore them. Even if you believe they're not severe, consult your doctor. Keep in mind that spotting issues early can greatly lower the chances of heart disease.
Thanks for watching.